Mayor Giles,
Here.
Councilmember Holmes,
Here.
Councilmember Nielsen,
Yes.
Councilmember Machezik,
Present.
Councilmember Sowers.
Here.
Thank you, Bessie Jo. The entire city council is in session. I'm going to review our published agenda wording on what is appropriate comment from the audience. So on our published agenda, there was a paragraph on the front page that said there will be no verbal comments accepted during the meeting. We did open public comment for a week. It closed today at 12 noon, and we had somewhere around 350 comments. Later on in our agenda, I'll be asking Councilmember Holmes to give us a summary on those comments. So again, no verbal comments will be received during the meeting. The only people that will be speaking are our guest speakers and the city council and city staff. Let me give you an overview of the agenda. Tonight's special meeting, we have two decisions that are before us as a council, and they're listed in the agenda under the business agenda as action items. The first item that we're going to talk about tonight is whether or not council wishes to adopt a resolution extending the requirement to wear face coverings for 30 more days. And in our packet, that is labeled as resolution number 20-16. If the answer to that is yes, and a resolution is passed, then we have one more decision to make, and that is whether or not we want to amend Emergency Powers Ordinance to clearly define the penalty section of this ordinance. There are two options in the menu. One version is a civil penalty, and then the second version, labeled version 2 in our packet, is an infraction, punishable by court action. Before we get to those heavy decisions, we're going to have briefings. Let me lay out who will be doing some briefings and how that interaction will occur. So we will start tonight's meeting with briefings and questions and interaction between City Council and our guest speakers. We're going to start with Dr. Greg Irvin, St. Luke's Mccall Hospital. And if Amber Green has joined us, she is the CEO of St. Luke's Mccall. She will also provide comments and be available for questions from City Council. And then I'm going to move on to Chief of Police Justin Williams, Mccall Police Chief, to talk to us about his experiences with his staff during the month of July, how things went. And he will give us an overview of the two options, civil penalty versus infraction. At that point, I'm going to ask Councilmember Holmes to give us the high points of the 350 comments that we received from the public. And then we will go into deliberation, and I'll facilitate that for the two action items. So with that overview, Dr. Irvin, I see you on my screen again. Would you please lead us off on your thoughts and suggestions as far as the resolution to extend the mask ordinance for 30 more days?
Thank you, Mayor Giles. I appreciate it. I appreciate being invited to speak today at this very important meeting. I'm actually, I want to thank the City Council for their courageous vote in early July to initiate the mask ordinance for the city of Mccall. There is no doubt in my mind that has slowed the spread of disease in the Mccall area and has kept our hospital from being overwhelmed by cases of COVID-19, which of course has all along been our biggest concern. We're concerned for the citizens of Valley County and of Mccall, and the City Council's courageous action has definitely had an impact and slowed the spread of the virus that was brought to us roughly 4 weeks ago by our guests and summer residents. So thank you for your leadership. I'm going to actually have Amber start out here with a discussion of Amber Green, our Chief Operating Officer, discussion of the testing circumstances at St. Luke's Mccall, what our numbers are right now as of the minute, and I'm going to have her, Amber's always right up to the minute on what our testing numbers look like. And then after she's done, I'm going to talk a little bit about a broader view of this and what my opinions about extending the masking ordinance are. So Amber, you want to take the reins here?
Thanks, Dr. Irvin. Can everyone hear me okay?
Yes.
Great.
Thank you for joining us.
Thank you, Mayor Giles and City Council for inviting me to join. Certainly, we want to be as helpful and transparent as possible in order to help you and assist you in making some of these tough decisions and keeping our community safe. So thank you for all you do for us, and hopefully we're able to help. Since our last meeting, we have visited with our St. Luke's Health System on what information we can provide that would be helpful to you in your decision process. We've been working very closely with our data and analytics team on getting as much information as we can to you in order to help inform your decision or decisions that you have to make. So far here at St. Luke's Mccall, and again, I want to stress, I'm giving you the numbers that are specifically from St. Luke's. There are a couple other areas within our county that are testing, and I don't necessarily have those numbers or can speak to them, but happy to share ours. Total tests ordered for today or up to today are a total of 1,256 tests. We have had 61 positive tests up through today, and we still have about 56 pending. So there's some that we haven't received yet, but are waiting on that information. I think that it's important to note that the majority of our positive tests have come in the months of June and July. Up through from March to May of this year, we had only had 2 positive tests at that time. Through June and July, we have seen an increase in positives. June, we had 27 positive tests. July, 32 so far. That does put us right now sitting for the month of July at about a 6% positive rate that we've experienced here at St. Luke's. One of the things that we worry about a little bit, and Dr. Irvin hit on this, is our capacity to continue to care for our community within the walls of the hospital. I will share some numbers that are across all of St. Luke's sites. Today we have 89 admissions across St. Luke's that are COVID positive. This is up from 84 last week. Today we have 21 ICU patients that have tested positive for COVID, and that is up 2 from last week. And then as the ventilated patients, we are catching these patients a little bit earlier and are able to apply some interventions that have decreased the ventilation utilization. And so we are today have 18 patients that are ventilated. This includes COVID and non-COVID patients, but a decrease from 35 last week. So, capacity and our ability to care for our patients that have COVID is very important to us. And so we're constantly monitoring the amount of patients that we're seeing with COVID. Of course, locally, we've explained that our COVID patients are shipped down to Boise. However, as we plan for surges in our volumes, there may be a case in which we will admit them here. However, we have capacity throughout the system right now in order to cohort those patients at Boise. That's all I have for statistics, unless there's questions, but I'll turn the time over to Dr. Irvin. Thank you.
Thanks, Amber. So I want to emphasize what Amber has said. With the 61 positive cases we've had at the St. Luke's Mccall testing facility, not all of those, in fact, only about half of them, roughly, are Valley County residents. The way that Central District Health notes cases, as we've talked about before, is by their home address. And so our summer residents and our visitors may be listed as being positive cases elsewhere. That's why our numbers don't exactly jibe with that of Central District Health for the Valley County numbers. Nonetheless, we have seen a definite increase in June and July in the number of positive cases, and we have undoubted community spread, which means that basically the citizens of Valley County are spreading the virus to one another, which is what we're trying to put a lid on and trying to tamp down because it's our best and really only defense against this virus. The intubation statistics for COVID-19 nationally and including in the St. Luke's Health System are encouraging in that we are intervening more effectively and more quickly, providing supportive care and avoiding intubation whenever possible, and avoiding a ventilator as a result whenever possible, because we know that outcomes are better if patients don't get to the point where they require mechanical ventilation and intubation. And that's through the use of antiviral medications, most specifically remdesivir, of convalescent plasma, which is the plasma taken from patients who have been previously infected, and with dexamethasone as a corticosteroid for supportive care to reduce the inflammatory response in the lungs. Also, good medical care has been happening in that patients that aren't intubated are provided high flow oxygen treatments with some very high tech mechanisms that allow them to be oxygenated without the need for mechanical ventilation, which we know reduces the risk of lung damage from the mechanical ventilation, which has been a problem in the past and ongoing. The virus it has hit Idaho particularly hard in the last 4 weeks. We are seeing an increase in cases in Idaho. The daily number of cases continues to bounce around at a fairly high level, and our resources for healthcare at our secondary and tertiary referral centers is definitely stressed, but not overwhelmed yet. And we really want to reduce the risk that our healthcare system will be overwhelmed. Nonetheless, we're now seeing the hospitalizations and deaths as the result of the cases that were diagnosed in early July, around the 4th of July and beyond, because when you're exposed to SARS-CoV-2, the virus, you don't necessarily become symptomatic for somewhere between 4 and 14 days. Then there's a lag time from the time you develop symptoms until people get sick enough to require hospitalization with pulmonary complications and neurologic complications and cardiac complications and renal complications that we're learning more and more about with this really nasty virus. And so it takes a time for them to become sick enough that they require admission to the hospital. And then there's another lag period between patients who become sick enough to require admission and those who unfortunately don't survive the virus. And that's why we're seeing our death rates going up this week alone. We've seen a number of deaths in the state of Idaho. We've had 81 deaths in just the month of July in the state of Idaho. And that represents 40% of the total deaths since February in our state. So we're seeing exponential increase in positive cases and then marked increase in patients requiring hospitalization, and patients who do not survive the virus. Ada and Canyon counties continue to be hotspots in the state, and among our visitors, they make up a large number of the folks that come to Mccall to recreate and to participate in the pleasures of West Central Idaho. But they are coming from an area that some states have actually banned travel from because of the high incidence of COVID in those counties. Ohio, for example, has banned travel from the whole state of Idaho and others simply to try to reduce transmission across state lines. We need to continue to be vigilant in prevention of the spread of the disease. We are still very limited as to what we can do about this virus. We're getting better at caring for it, but it's still a deadly virus and still wreaking havoc in our state and in our country and in our world. The main things that we can do are the things that we all have burned in our brains at this point, and that is to reduce the spread of the droplets, the microscopic, very small droplets of vapor that come from our mouths and noses when we talk, laugh, sing, cough, sneeze, etc. A good representation of those droplets is when we're out on a 10 below zero Mccall winter day and we breathe hard, shoveling snow or whatever. That cloud of steam that we see around our respiratory tract are exactly those droplets that are freezing in the air and creating that cloud that's around us. Being outdoors helps because outdoors is better ventilated than indoors. Those droplets disperse much more quickly in an outdoor environment, but wearing a mask makes a big difference. And there is increasing evidence, in spite of all the misinformation that's been spread about this, that if everyone were to wear a mask, both the sender of the virus and the recipient of the virus, we would reduce viral transmission by 400%. That's a 4 times reduction in transmission. It isn't perfect and it doesn't protect us perfectly, but it certainly makes a very big difference. So I would encourage the City Council to stay the course, to continue the masking ordinance. This has given our businesses, our indoor places of business, our places of worship, the places where people congregate, it has given them cover to require masks in their places of business. And though it's not perfect, though not everyone is wearing masks, though there's still a lot of misinformation about the use of masks, they work. And they work well enough that we need to continue this ordinance at least until September 1st. I'm hoping that as we get into August and September and our visitor volumes drop off and we're seeing less in-migration into Mccall, that we will see our viral transmission rates in the county drop off as well, especially since our citizens have been so fantastic about maintaining these precautions, and that we will see our viral transmission reduced to the point where we could potentially start school, where we can all go back to our jobs if we're not there already, where we can resume some kind of life that allows our economy to stay open, our schools to stay open, and our citizens can get together to worship and do the things that they want to do. We're going to do that best if we keep our disease transmission as low as humanly possible right now. I encourage you all in the name of public safety and in the name of keeping our businesses and congregation points open and allowing school to start to reauthorize the masking ordinance till at least September 1st.
Thank you, Doc.
Any questions?
Thank you, Dr. Irvin, and thank you, Amber. I really appreciate getting credible, up-to-date scientific and medical information from St. Luke's. I'm going to poll the council and let them have a chance to ask you questions, either either Amber or Dr. Irvin. I'm going to start with Melanie Holmes. Do you have any questions for St. Luke's?
No, I don't have any questions at this point, but I do want to just thank you both for the information that we are receiving now. And I feel like we know a little bit more about what's happening in our area, and I really appreciate that. Thank you.
Thanks, Melanie. I'll next go to Mike. If you are on with us, do you have any questions or comments you'd like to interact with St. Luke's?
I don't. I just wanted to echo what Melanie said, which is we really appreciate the responsiveness by St. Luke's in providing us additional information, and appreciate everybody in our healthcare community for the dedication and how they've been handling things.
Thank you, Mike. Tom, you're next.
All right, sure. Hey, Dr. Irvin and Amber, thank you guys for joining us. Dr. Irvin, you use a lot of words like marked and substantial and great increases, but those aren't real numbers. And I know you're a statistics guy. You probably got at least a B in statistics, I'm imagining. So out of our 89 COVID patients that were and our 18 that were ventilated, what happened to all those people? What's the final result there?
Well, those are people who are currently, the numbers Amber gave you are people who are currently in the hospital, in the intensive care unit, sometimes not ventilated in the ICU, but receiving a high level of care that requires intensive care. And the folks that are ventilated are the people who get to the point in the disease progression with COVID-19 that requires mechanical ventilation. So those are current today numbers as to what's going on in our system.
So what's our getting better rate? What is our recovery rate at this time?
Well, the recovery rate for this virus is ultimately, depending on how you define recovery, and I don't mean to sound like Bill Clinton, but it's a definitional thing. Recovery, if you define recovery as surviving, the recovery rate is somewhere between 99% and 99.3%, somewhere between 0.7 and 1% of people who develop symptomatic COVID-19 pass away. And that's still a number that's very, very hard to determine because we still have a great deal of difficulty with it.
Okay, so where would that number rank in, say, things I might die of? Is it in the top?
Well, right now, COVID-19 is I believe I read an article just in the last week that said COVID-19 has become the #1 cause of death in the United States.
So it's surpassing heart disease, it's surpassing cancers.
Yeah.
It's surpassing, really?
Yeah. Yeah.
Okay.
Yeah. If you compare it to something we all know about, which is seasonal influenza, which has a 0.1% case mortality rate. If you get influenza, you have a 1 in 1,000 chance of dying of influenza. It is somewhere in the range of 10 times more lethal than seasonal influenza.
So roughly 10 in 1,000.
Yeah, or 1%.
Okay.
Yeah.
So we're still speaking on fractions of small percentages. What happens to most COVID positive people?
Well, most COVID positive people don't die, but do have long-term, we're learning a great deal about the long-term implications of developing symptomatic COVID. So people who survive, and that's by far and away the majority of people, we're seeing long-term health effects, including lung damage, cardiac damage, neurologic damage, brain injuries, microinfarcts, which are small blood clots that form when you have COVID-19, that can cause damage to your kidneys or your brain or your heart. And there are many people who have what we medically refer to as morbidity from this. Morbidity is different than mortality. And morbidity is the health effects that seem to persist for a very long time related to having COVID. Those numbers are still evolving. We're still trying to determine the long-term effects of COVID. It's only been around in the United States since late January. We're really only learning what the long-term implications are. But there is no doubt that this virus does a lot of damage to the human body, even if it doesn't kill the human body.
But what you're saying, most people who get COVID are fully recovering, or so if they used to be able to run a marathon, they can still run a marathon.
If they don't get lung damage, if they don't get heart damage, if they don't
Well, I
get
mean, you're
kidney
saying
damage.
if, I'm saying statistically.
Statistically, we don't know the answer to that yet. We know that there are long-term organ injuries to this, and that many people who get COVID, we don't know the statistics, we don't know the numbers, but we know that there is organic damage to the human body resulting from COVID-19 above and beyond mortality, above and beyond death. But 150,000 plus people have died now in the United States of COVID-19 just since it came to us in January. Those are very disconcerting numbers. And let's just say that the mortality rate.
With those numbers too, what's the number of what's the percentage of that are people over 75, over 85, things like that?
Well, this is much harder on the older geriatric population, right, without a doubt. But young people die too. We had a nurse practitioner in her 40s who died of cardiomyopathy from COVID-19 just a couple of weeks ago. But a cardiomyopathy or a large heart. We had an Olympic runner that died during the Olympic trials from that. So I mean that was. Yeah, but this was a cardiomyopathy caused by COVID-19, without a doubt. And there's a very good explanation of that that's been distributed in order to reduce the disinformation that's been spread about that case.
I read her case today. I was trying to read through it today. There's a lot of, like you say, there's a lot of bad information, a good information, and an overload of information. So we got to weed through all of them.
Exactly.
So what is our current census?
Last, many months weeding through a lot of information.
Oh, so. I have no doubt. You're probably not alone.
Yep.
So what's our current census at St. Luke's Mccall?
Amber would know the answer to that. As of today, we have been excuse me, we've been cohorting patients who arrive at our doorstep with COVID-19 to the hospitals in the Treasure Valley because we are not prepared with an intensive care unit, with infectious disease specialists, with the medications that are needed, remdesivir, and so on, to be able to treat patients at this moment in a way that they can be treated at a tertiary care center like St. Luke's Boise, for example. So we've been cohorting patients. We have no COVID patients in St. Luke's McCall. We had one patient who spent one night here so far.
Either, right? So Doctor, we won't have COVID patients in St. Luke's McCall, correct?
If we can avoid it. My biggest worry right from day one of this pandemic is that the hospitals to whom we refer, which are the hospitals in Boise, the Treasure Valley, the tertiary referral centers, will become this has happened many places, and I'm concerned that it will happen here, is that they will become overwhelmed and will be unable to accept transfers. And then we're going to be admitting patients to St. Luke's McCall. And we're prepared for that. We have ventilators, we have the people we need to provide the care. But if I develop COVID tomorrow, I would rather not be admitted at St. Luke's McCall if I could avoid it, because I want, and as we all would want for ourselves or our families, the highest level of care available to survive this thing.
Right, absolutely.
Dr. Urban, this is Amber. I could just answer Councilman Sauer's question. Currently, our census is 9, and we reach our limit at 15. Right. One of the, we're talking specifically about COVID patients. One of the things that I worry about is we still, even amongst a pandemic like COVID, have to manage or be able to manage other disease burden as well. We have to still be able to treat patients with stroke. We still have to be able to treat patients with heart attacks, with pneumonia, with sepsis, and other things as they come in. So, it's not just the COVID patients that we're worried about. And this is why the masking is so important to me, because it does help control the spread of COVID to the fact that we can continue then to treat the other patients within the walls of our hospital, and we're not completely overwhelmed with just COVID patients. So.
And exactly that happened in Blaine County at Wood River Hospital in March. Their hospital became so overwhelmed with disease burden from COVID, they had to shut everything down except for COVID. Their women in labor were being sent to Twin Falls to have their babies. People with heart attacks were being sent to Twin Falls. People with strokes. That obviously that's not ideal care by any means, but they were thoroughly overwhelmed.
A lot of those, that's what they would do anyway. They would life flight a lot of those patients you're naming as strokes. Your stroke's not going to stay in Wood River. They're going to go somewhere else because they can't.
Well, it depends. There are lots of what ifs about that. Wood River is a fine medical center, and they keep a lot of really sick patients there. Yeah.
Yeah, I'm no doubt about it. But just like Mccall, we don't have that particular capability, so we would package and transport appropriately. I just think that does anybody offhand know what our percentage of ICU just for St. Luke's? And I know we still have Syringa system, we still have St. Alphonsus system, and a lot of other larger systems sitting around in our neighborhood. But what's our percentage of ICUs that are full?
Well, in recent weeks, St. Luke's Nampa ICU was full and was cohorting all their patients with COVID or needing ICU care back to Boise. St. Luke's Meridian intermittently has been full. St. Alphonsus intermittently has been full. We're tickling the edge of our capacity. We are working day and night to keep that capacity available, and we all hope and pray that that continues to happen. But if we don't reduce the spread of the disease in the state of Idaho and in Valley County, we significantly request we need to reduce the spread of the virus. And one of the few ways that we can do that and still keep the economy open and still not have to shut down is that if we don't slow it down, we risk exactly the scenario we're talking about. There are trend lines. We do a lot of modeling in St. Luke's, and there are trend lines right now that show that at the pace of viral growth in the state of Idaho, if there's no intervention, if nothing happens and we just keep going like we're going, we will be overwhelmed. And then we're going to be admitting patients to St. Luke's
well,
without an intensive county unit. If the
what
trend line
don't
continues.
like we're going, because our rates are very steady, and that's according to your graphic and your testing and your positives. Our death rates are not increasing. Our hospitalizations are increasing slightly, but not to not to the extent that we're concerned about.
Well, I'm very concerned. And our epidemiologists, the people that work with the numbers and do modeling on the way the virus is behaving in the state of Idaho, we have a lot of concern that if we don't get serious about slowing this down, we're one of the red states in the entire nation in terms of viral growth. Our testing rates are well above 10%, which is considered unacceptable. In other words, 10% of people who get tested in the state, more than 10%, I think it's up around 18% right now.
Yeah, I thought it was about 19, but
yeah. And that's a very high testing rate, meaning that we're seeing the reason we're seeing more cases isn't because there's more testing, it's because there's more disease and there's more virus in the community. And we're on a trend line based on very elegant modeling that's being done by our epidemiologists that we risk being overwhelmed if we don't slow this thing down.
Well-
And I'm not saying that to frighten people. I'm telling people, saying this to convince people that we need to be very serious about this. This is not something that we get information from Facebook, from social media, from unauthorized, ill-informed sources, that we listen to the experts that are working
Well,
day and night to try
I'm
to
using,
keep us
I'm using a
this under
chart
control.
from St. Luke's,
Yeah.
Doctor. I'm using your chart.
Yep.
I'm
Well,
not,
that's good.
I'm not using anything from anybody else but St. Luke's because
Good.
that's where I would go for the correct data. We've been saying these same exact things since the 13th of March.
And we're going to
that-
be saying these things until we get a vaccine.
Well, the thing is, the danger level doesn't match the panic level. And what we're doing to people, we're ignoring mental health issues. We're ignoring substance abuse issues. We're ignoring, a whole bunch of things while we're pinpointing, concentrating on COVID-19.
Well, I'll take umbrage to the fact that we're ignoring mental health or substance abuse. We have physicians and nurse practitioners and practitioners in general and mental health professionals in our hospital that are working day and night on that as well. That's
Well,
part of what
over-
Amber was saying.
well,
We
we
have a
have our
lot of
school-
other things that we're taking care of.
Right. We have our schools closed right now. And where do our mental health referrals come from? They come from schools. They come from teachers that notice things with children. Those things
Sure.
are being ignored right now.
Well,
And from the way we're talking, we're all trying to ignore it into the future. And that's kind of where we're at. We're so pinpointed on putting a tourniquet on this cut finger, and we're ignoring the bleeding of life.
Yeah. Well, I would take umbrage with the fact that this is a cut finger. Okay. I've been practicing for 38 years. I've never seen anything like this ever. And I was told when I was in medical school that this was coming, and warned that we had to be ready. Well, guess what? We weren't ready. So,
Gentlemen,
I
let me,
think we were very prepared. Thank you, Dr. Urban.
You're welcome.
That's all I have. I really appreciate it.
okay.
Thank you.
thanks, Tom, for wrapping that up. And thank you, Dr. Irvin, for answering all those questions. Colby, you're next.
Well, hello there. Yeah, I guess really one of the only questions I have would be on the testing procedures, to just check in to see if anything has changed since the last time we talked in early July.
Amber can talk to you, Colby, about what our testing reserve is. We've been very, very careful with who we test and when we test them. A test means at a moment in time, someone does not, minus the false negatives, have SARS-CoV-2 in their nasopharynx. They could go out the next day and contract the disease, and then the test is of great concern. But we've had to be very careful with who we test and strategically testing so that we can, again, try to reduce disease burden in the community and get the folks who are, in fact, shedding virus isolated, contact traced, and taken care of. Amber, do you know what our test reserve is right now?
Thanks, Dr. Irvin. Yeah, so we there are 3 types of testing that we're doing currently. We're doing what we call a priority 1 testing, which is testing for patients that are in our emergency room or inpatient units. We're able to do this in-house, and we have a fairly quick turnaround time because it is dependent, those test results are dependent on how we're going to be treating those patients, and we need fairly quick results. Right now, we have the appropriate amount of reagents as well as supplies to continue with that type of testing. The second type of testing is for what we call procedural testing. These are for patients that have determined that an urgent need for surgery, and that testing can be done when we schedule the patient for surgery. Our turnaround times for that are anywhere between 24 and 48 hours. It is sent to our core lab in Boise and ran there. The third type of testing that we do is our symptomatic testing in the car clinic. Due to the volumes of this type of testing and the individuals that need this testing, we do see longer turnaround times. But currently in our car clinic, we do have adequate amount of testing supplies in order to collect those. They're actually shipped out and ran at a separate lab. But the turnaround times are a little bit longer there. We're looking at a 7 to 10 day turnaround time currently for those tests. I hope that answers your question, Colby.
Yeah, it does. I'm pretty sure. I guess it sounds like if someone were to show up and want to get tested, they might get sent down to the valley still at this point.
Well, it depends on the indication for the test. If somebody comes and sees us and has symptomatic and meets the screening criteria for receiving a test, they'll get a test here and they'll get it expeditiously. The turnaround times have gotten long because there's such a massive amount of testing going on nationally that we are working mightily to get our tests back in a timely way so that it can do some good. The important message is if someone is symptomatic and meets criteria for having COVID-19 infection, they need to be isolated until they've been tested and the test is back so that they don't spread it in the community.
Sure, yeah. I guess my big concern is with the ease people are able to go in and be tested because obviously the majority of people are concerned about this and they don't want to be the one continuing to spread it. And I think that's important to have easy access to that rather than sending people down the valley. That's one of my only concerns. And
they may go to the valley and not get tested there. If we could test everybody every day, it would be a wonderful world. But you could get tested, have instant result. You could be tested before you go to work in the morning and know that you weren't spreading the virus at work. That capacity is just not there in this country. In spite of the fact that massive amounts of testing are being done, it's just it's physically impossible to do at-will testing for everyone who wants to be tested, especially if they're asymptomatic. If they're symptomatic, we're going to get them tested, and we're going to get the results back as quickly as we can. They don't have to go to the valley. But if they're asymptomatic, that's a very much a different thing.
Yeah. Yeah.
I believe that Rite Aid is still doing the testing with Crush the Curve, that you can just go and be tested. You do not have to be symptomatic. It's sent off and that they are doing the testing there. They were as of last week. I'm unaware if they're still continuing that. So that test was available here locally for those that just wanted to be tested.
Yeah, Rite Aid has that. The turnaround times on that have been rather long, but it is available through Rite Aid. And I don't think that's Crush the Curve. I think it's another testing facility that Rite Aid itself is doing. So.
Yeah, I mean, I guess that, I don't know, you get what my concern is.
I understand completely. I would like to be, I've never been tested. And I'm exposed at the hospital, not uncommonly. But I don't want to use a test that someone who's symptomatic needs. The point of this whole thing is, if we can prevent disease transmission with all the things we talked about, including a masking order, testing becomes a lot less critical. It becomes a lot less important because the person who's shedding the virus is the one that it is most important that they be masked. But if both members of an encounter are masked and you have an encounter with people where you're sharing each other's breath, you reduce your risk of transmitting the virus by 400%. If there was a pill that you could take every day that had no side effects, no complications, and it would reduce your risk of disease transmission by 400%, I'd take that pill every day. You probably want to take that pill too. Well, that's a mask.
Yeah, I guess for the sake of time, that's not really what I'm getting at here. I was kind of concerned about the testing, and
Yeah,
Oh.
we'd love to have a lot more testing, Colby. If wishes were horses, beggars would hire. I wish we had
Sure.
all the testing that everybody wanted at will. It's
No.
just not there.
I get it. I was just checking
Yeah.
in an update. I appreciate it. And I
Yeah.
would like to echo the other council members' compliments of you guys doing a good job of improving your communication to the community. We definitely feel a lot more informed now, and thank you guys for making that effort to do that. I think that's all I've got at the moment.
Good. Well, knowledge is power, so that we hope we're helping you be powerful.
Thank you, Colby. Thank you, Dr. Irvin. I have no further questions as a member of City Council. Again, I would like to thank the two of you for joining us tonight and ask you to stay online if you would, because we may have some questions after we hear from Police Chief Williams. Would that work for you, Dr. Irvin? Would you be able to stay on for?
Yeah, I'll stay on for a bit. That's fine. Sorry,
Thank
the ER is calling me here, but it's nothing that critical yet.
Thank you. So now we're going to move to Mccall Police Chief Justin Williams. And I asked Justin earlier in the day to brief us on how things went in July, the first 30 days, from a law enforcement and effectiveness. And then I asked Chief Williams to also talk to us a little bit about the two options that would be considered if we approve the resolution to go another 30 days. There was option one, the ordinance that talks about a civil penalty, and then option two, which is the, help me with the words, Justin, it's a
Infraction.
Infraction.
Yes,
So
sir.
you're on. Thank you, Justin, for joining us.
Good evening, Mr. Mayor, Council, and guests. My name is Justin Williams, Chief of Police for the City of Mccall. I am not a doctor. I'm not going to pretend to know everything there is to know about this disease, how it spread, or things of that nature. But what I do see are statistics. I've been in charge of the city's COVID response since March 13th as incident commander for the City of Mccall. This mask mandate was implemented July 1st. In the state of Idaho, July 1st, there were 5,786 infections, positive tests in the state of Idaho. Today, we sit at 19,769 positive cases. It's a 240% increase in 1 month in the state of Idaho. And now we sit at 61 positive tests in Valley County. I believe at the time this was implemented, there were 3. We are seeing what we had anticipated was going to happen with the increase in visitors in the state of Idaho, and particularly in Mccall and Valley County, with the influx of visitors that we were going to have and the transmission rates going up. From the standpoint of law enforcement and enforcing these particular ordinances, mandates, health orders, there were issues with the original resolution as it was written, in that the state court system did not have a violation code for disobeying the health order mask mandate. The violation was not listed in the particular resolution, and it did not refer to the emergency health order. So we scrambled to be able to enforce this particular ordinance and worked with the court systems and the city prosecutor closely and worked with the state to remedy that particular issue. That's why you're seeing the civil versus criminal penalty attached to this. There was only one particular incident in which the mask order was enforced, and it will be going through the courts because of the fact that the resolution was not, did not appropriately refer to the statute for the particular infraction. It will be prosecuted as a misdemeanor offense, and then should it be chosen by the city prosecutor to go ahead and reduce that to the infraction, then that's what will happen. As Mayor Bob explained, the first order of business tonight will be for council to decide as to whether or not they choose to extend the mask mandate. It is set to expire on August 1st. If you choose to extend that particular order, there are two options that we have brought before you as your chief law enforcement officer for the city to make this particular violation of refusal to comply with the health order a civil penalty, meaning a notice of violation for an ordinance violation, such as a parking citation, the ones that we issue. Those fines are handled at the city level. They do not go to criminal courts. It's handled at the city level. There is the administrative costs that are reduced because you don't have a city prosecutor that's involved. Witnesses don't have to come for a court case. The administrative hours for logging those is quite less than a criminal case, such as an infraction would handle. It removes the criminality from the offense. It is a civil penalty, and it's much faster to take care of. There's an appeals process for violations of those, or for those particular violations that is set forth, so people can appeal the citation issuance to me. There are many cities across the United States that have moved to do this with most of their code violations. This was a topic and a recommendation that I made 3 years ago to City Council to decriminalize our city code and make it civil fines. With the civil fines, they're provided the notification of what the fine would be, and if they don't pay it, what happens if they don't pay it. And then eventually most cities send them off to a collection service if the people refuse to pay those citations. But it's not criminal. It's all civil. What we found is that there's a high compliance rate typically with the civil fines and rather than the criminal fines, because in a criminal court it could eventually, with misdemeanors and such, go on your criminal record, so people will fight those and rightfully so have their day in court. That is the civil portion of it. The other aspect that it could be, the penalty and punishment, could be an infraction. The infraction is now listed in the state code for the city of Mccall. We are set, if you choose to extend the order, to go either way, with the civil or with the infraction. The difference with an infraction is that it has to be issued by a law enforcement officer. This notice is not a notice of violation. It's an actual citation, such as those that you receive for a speeding ticket or a no insurance ticket, seatbelt ticket, those types of fines, or a citation for any other possible ordinance violations that are in our city code. Those are set for court. You can either pay the fine and plead no contest or whatever it is that you choose to do, or you can set it for court and you can have your case heard in court. With that, there's fees and court costs that go along with it. So the $100 fine ends up being $156.50 by the time court costs and such are levied in on it. So it's a $100 fine, $56.50 worth of court costs and administrative fees. Then you have to have the officer's time for creating the narrative in the report that's going to go with the infraction. If it goes to court, you have their testimony that's involved. You have the witnesses. You have the jury that might have to be there. You have the city prosecutor that would need to be there for the prosecution phase of it. Then the court clerks that have to record it. And there is a sense of criminality. If they fail to pay that citation, then it becomes a misdemeanor. It bumps up. And so those are the choices that will be laid before you for discussion. As far as compliance with the ordinance as it sits, there's an overwhelming response that we've gotten from the citizens just in our interaction that they are supportive of this particular ordinance, that they are happy. Those are the residents. Those are the people that live here full time. Those are the people that are here and see what's going or possibly could happen to the community. We see a very high compliance rate within businesses. We see that people are wearing masks quite regularly, and the shopping for the groceries in the grocery stores and such, in the post office, in these particular places, you see that it's very common. The places that we see that we don't get compliance are in the social settings, such as in restaurants. Obviously, they're not going to wear those. But within the residents, it's the social aspect that we tend to let our guard down. When we're with friends, when we're with family, we're at a barbecue, we're doing those types of things. That's where we're seeing the highest number of infections come out. And then with the 18 to 24 demographic, according to the state, that's what we're seeing, is that these are the individuals that are socializing outside of the structured environments. But within the structured environments, within the business, we're seeing a very, very high compliance rate in comparison to what it was previously. So that's a short summation of where we stand, what the enforcement was previously, and the two options that you as council will have a choice should you choose to extend the ordinance. I'm available for questions. If you have those, please let me know and I'll answer them to the best of my abilities.
Thank you, Chief. We'll start with questions from Melanie.
Hey, Chief.
Hi.
Nice to see ya.
Good to see you.
So I just want to make sure I understand this correctly. The civil penalty is the lesser of the two.
The civil penalty is lesser of the two. It's handled in-house. It does not go to the courts. It does not go to the state. It is, think of it as a local fine. And that is something that we use for the parking citations. It's a $25, $35 fine, pet tags, things of that nature, these very low level offenses. There is nothing further than it going with the city. There is no criminal penalty attached to it, period. And so that's what we're looking at. That's one of the things that I've recommended for most of our code ordinance violations that we move to in the future.
All right. Thank you very much.
Mike,
Other
questions? Questions from you for Chief?
Yeah, sure. One quick one. So if you have the civil penalty choice, then if we had a situation, for instance, where somebody came into some kind of place of business, for instance, and was being fairly belligerent with the folks that work there, and they were to call the police and, we have a concern, so then they would receive the civil penalty if the police came. And if the person were then further belligerent in some way, then that may involve other types of charges. If they were somehow violent or trespassing and refusing to leave or things of that nature, right?
Yes, Mike. And that reverts back to what we've talked about during this entire process, even before the mask mandate came out, that there are remedies for people that refuse to comply. I've spoken numerous times to the Chamber of Commerce and different businesses and met with different businesses in the beginning and spoke with May Hardware, for example, that has had a mask mandate from the very beginning of all of this that they implemented on their own. There are other businesses that did the same thing. I believe Bella's Kitchen did the same. And that people that refuse to comply, it falls back to the no shirt, no shoes, no service type of orders that businesses are able to do. And if people refuse, call the police, call us. That's what we're for. We would much rather show up to a situation and not be needed than to be needed and not be called. There are remedies. If they get belligerent, they get out of hand, then there's something other than the mask ordinance that can be addressed. Absolutely.
Yeah, that was it. Great. Thank you. Thanks for all your work on this.
Thank you, Mike.
Thank you, Mike. Tom, you're up next. Questions for Chief Williams.
So Chief, do you
Tom.
think that the individual business mandate works better than the citywide mandate?
Well, if you're asking me as far as compliance, the businesses, there are some that took that step to go out and be proactive in that. There are other businesses that were not willing to do that and would ask for city intervention, specifically to have us make the ordinance, and for lack of a better term, to make us be the person that's pushing this rather than an business in particular. And so there was a high compliance rate in those particular businesses that they had people at the door asking them or telling people, you need a mask, here's a mask, do this. But as a compliance rate after, I've seen more masks within those places such as the post office, Ridley's, Albertsons, all the places that I frequent to shop. There is a high compliance rate after the mask. It's definitely changed just in our contacts with people. But as far as the success rate, which one's more successful, I wouldn't have the statistics on that.
Right. Okay. Yeah. I just, from talking to a lot of businesses, I think the ones that implemented on their own are happy with the results, and the ones that did not implement anything on their own were also happy with the results. And that I felt like the city intervention wasn't necessarily our best move, but I know you guys are doing your job, and thank you. And I know it's a difficult position, so I think I'd just rather would see the businesses take their own and make their own thing. If we did set a fine, could we set a fine for maybe the change in your pocket and have it implemented right when you contact them, since we do have a little bit of a change shortage going on?
I'm not sure what you're pointing to at that one, and so I would have to defer to someone else on that about the legalities of different fines for different peoples and not going through the court systems and such. So, like I said, I'm just a cop, so I deal with the cop things. But thanks.
All right. Hey, thanks, Chief.
Surely.
Thank you, Tom. Thank you, Chief. Colby, you're next.
Hi there, Chief. I guess I only have one question, I guess, regarding the difference between the citation and the infraction.
Yes, sir.
Does the citation open us up to any other liabilities? Like if it were a state violation, would that ensure more protection for the city versus a citation? And this one might be a Bill Nichols question.
Colby, I don't believe that it's going to open us up because we're taking enforcement action either way, and then that's where it falls into the liability issue. We vetted this particular issue with Bill. There are other violations that we do notice of violations, primarily for business licenses and such. So we do use that route for other violations of city code. It's already being used. The reason that I brought this particular option to council is the ability to remove any criminality from the violation so that it stays completely out of the criminal courts, and then it's not something that is tried in the courts nor in the court of public opinion for that matter, and that our liability is no greater civilly or criminally on that. Now, if we were taking criminal action and something happened as far as law enforcement, the standard and burden of proof for the criminal aspect is much higher than it is for civil. Civil's 51%. Criminal's beyond a reasonable doubt. And so civil's much easier, much faster to go through, and we're already using it in other areas. So I wouldn't anticipate that our liability would be any greater or any less for that matter.
Bill Nichols, this is Mayor Bob. Do you have any further thoughts on Colby's question?
Hello, Bill.
I can see that he's unmuted, but we can't hear him. He may be having problems with his speaker.
I'll go with my answer.
All right.
I think this will be kind of the second agenda item anyway, so we might be discussing this more. We might be able to get the technical difficulty figured out. Yeah, I guess that's, my concern with that is just from hearing and reading comments of, the constitutionality and the legal threats and the pitchforks really coming out. I would like to make sure that that doesn't expose the city.
Absolutely. And that's something that we vetted in the very beginning of this, because prior to any of this being implemented statewide with the health orders and things of that nature, we were very clear on where our statutory authority lies within the state of Idaho, and with the governor. We were provided the appropriate information of what to cite under, what the codes were, the state codes. And by taking this extra step and implementing the mask mandate for the city of Mccall, that changed things, and that put more of a responsibility on the city, but we still have that authority through the emergency powers ordinance and the health and safety. And so we are on firm ground in doing this. And we have been counseled by ICRIM regarding this. And we're in contact with them monthly. In the beginning, it was daily regarding how do we enforce this, because for law enforcement, this was totally new. We've never done emergency health orders before. This is the first time in 26 years of being a cop that I've ever dealt with a criminal being a virus. And so we've had to adjust. And so I wanted to make sure that our staff, that my officers, that your officers were serving the city, and that we were doing what was just and what was legal and what would minimize any exposure or liability to the city. And I feel very confident that we've been able to do that thus far.
Great, thanks. That's all I have.
So Colby,
Thanks.
this is Mayor Bob. Thank you, Chief Williams. I just got a message from Bessie Jo. She's trying to contact Bill Nichols and get him on the team's environment to be able to talk to us. So when we get to that topic, we revisit that and ask his opinion.
Great.
I don't have any further comments. It's been a really good discussion and back and forth, and thank you for answering all those questions, Chief.
Yes, sir.
Mayor, this is Bessie Jo. I have an email from Bill Nichols, and he says that the penalty does not affect the enforceability of the order. And if the state were to implement a statewide order, or Central District Health imposes an order, it would be the state code, not a city offense.
Okay. Thank you, Bessie Jo. Appreciate you relaying that information. So I'm going to suggest we go to the next part of our agenda. Let me look at my notes. Overview of public comments. Before I turn it over to Council Member Holmes, let me just give you a couple of prefaces. Bessie Jo looked at all the data today. We had 350 comments total, approximately. And as Melanie said earlier, some of these there are multiple people. Excuse me, there's the same person commenting several times. So there's some nuances that she will discuss with us. I will say that we had an abundance, I would use the word dozens of comments from people at St. Luke's involved in the healthcare field, and they were all very concerned and expressed the same opinion that we heard from Dr. Irvin and from Amber Green. So with that introduction, Melanie, thank you for doing some analysis for us, and please share that with the entire council.
No problem. I mean, I did several things, but the initial thing that I did was I read through every single comment, and I did a simple for or against. And what I did was I took out the multiple commenting portions and just gave each person their one for or against. So I ended up with 339 comments total. 300 exactly were for, so that's 88.5%, and 39 were against, which is 11.5%. Approximately 6 people in the for column asked for additional enforcement. Everybody else pretty much was a simple please extend. In the against column, there were multiple duplicate comments, which was interesting, but even more interesting was that about 5 out of the 39 people that commented there don't live in state. So, but regardless of that, I counted them as well as everybody else. I just went with the simple for and against, and you know, it was pretty overwhelming to see what came through with the 88.5% for. So
Thanks, Melanie. Let me provide a little opportunity for questions for Council Member Holmes. We'll start with Mike.
Sure, yeah, I did the same analysis of the comments. I came up with well over 300 written comments of those. I didn't find 39 that were in opposition, but some of the ones that were fairly strange, I did not include in my tallies. But interestingly enough, based upon the addresses provided in the comments, I only saw one in opposition who lived within city limits.
Thank you, Mike.
Interesting.
Tom, you're up next. Questions for either Council Member Holmes or Machezik.
Nope, I read through everything as well, and I came up with pretty much the same numbers. So,
thank you. Colby, questions?
No questions. I did the same thing, read all the comments and a little tally. So I think we're on the same page with what you think.
Thank you, Colby. So I want to thank the entire council for doing due diligence. And Bessie Jo, as our clerk, thank you for sending us out daily summaries starting this week so that we didn't get it last minute. It was extremely helpful to all of us to be well informed. So with that, we're going to deliberate on the two decisions. We're going to start with, I would like you to reach into your packet and pull out the handout that says City of Mccall Resolution Number 20-16, a resolution to extend the public health emergency order for another 30 days. So if you could find that in your packet, we are going to run through each council member, and I will ask you, are you in favor of making a motion to adopt Resolution 20-16? I'm going to start with Melanie. What's your position on extending and adopting a resolution number 20-16, which would extend for 30 days till September 1st?
I'm in favor.
Thank you, Melanie. Mike, what's your opinion on this?
Yeah, and hopefully we have lots of people in our community listening tonight as well. I just wanted to start by revisiting the City Council Mccall vision statement, which some people may not be aware of, but nonetheless, quickly, Mccall will be a diverse small town united to maintain a safe, clean, healthy, and attractive environment, to be a friendly, progressive community, affordable and sustainable. So I kind of said a similar thing in the prior meeting discussing this, and I believe that we as members of Mccall City Council were elected by our community to, one, represent the best interests of our community, as in our vision statement, essentially somewhat of our oath, to maintain a safe, clean, healthy environment, to make decisions based upon consultation from experts in their field, and to make decisions based upon what our community is asking us to do. The healthcare experts have asked us to extend our public health order another 30 days. Our community has been given 7 days to respond and provide input in writing. We've received well over 300 written comments. Of those, a very small, what I found was about a dozen that were in opposition, and based upon those addresses, like I mentioned, I only see one that's within city limits. Our community's overwhelmingly asked us to listen to the healthcare community and to listen to them. To do otherwise is to disregard both the advice of our healthcare community and our citizens. And I'd like to move that we adopt resolution number 20-16.
Thank you, Mike. Let me hear from the other council members, and thank you for your summary on that. Well stated. Tom, I'm going to go to you next, and then Council President Colby Nielsen.
well, I agree with Mike that we're responsible for for safety, but we're also responsible for bringing people together. Although the written comment didn't match I guess, a statistical significance. I believe that there's a lot of people who they feel like it's hopeless. They feel like that there's no reason to write because, or there's no reason to say what they are thinking. There's business owners that are not being represented, and I feel like that's my job to represent those folks. So I think we should let this expire, and if we do consider a fine, I seriously think a civil penalty for not wearing a mask should be $1 for a person who's just not wearing a mask. Now, if they're being belligerent, arguing with officers and things like that, those will be different things. But I'd like to see this expire, and if we vote the other way, then so be it.
Thanks, Tom.
Yep.
Colby?
Yeah, I agree with Mike's comments that, we are responsible for the health of our community. We've listened to medical professionals and got the best advice we can find regarding this new and challenging issue. We've listened to our community and what folks in the community would like to see. There's definitely some folks that don't agree with the mask ordinance, and that's fine. And there's kind of this cry that says this is dividing our community and this is being very divisive. And I think to some degree that's not entirely wrong. And I think that everyone needs to take a little bit different look at what this ordinance hopes to achieve, where we have very few options in our community to try to help protect our members, so the folks that live here. We want to try to keep everyone as healthy as we can. We're also wanting to have our businesses survive, and it's going to be a challenging year. And the reality is that we don't want to shut the whole community down, but that's really probably the best solution to try to stop the spread of this. But no one wants that, and I don't want that, And so what do we have left other than to try to do our part, each of us individually and as a community, to try to prevent the spread of this disease and just, get through this period of time, because we will get through it. But it's definitely a challenge right now, and it's scary, and, it's wearing on a lot of people. It's putting the whole world in an uncomfortable and an unknown place for the individual and families and businesses. We don't know how to react to this, because it's something that we've never had to experience. And so I guess in closing, I think that it's important for everyone to remember that this is about uniting the community and trying to make our community healthy. And this isn't about driving a wedge between ideologies. This is about trying to get through this together. And I would like to speak to the folks that are calling out the folks that aren't wearing masks, or the businesses that aren't choosing to comply. With this, we have a mechanism. You can call the police, and the city can come in and deal with it. There's absolutely no reason that people need to be shamed and put down and abused for believing what they believe. This provides a mechanism for a civil conversation with law enforcement and individuals who don't want to follow this ordinance. There's no need to be abusive about that, and vice versa. There's no need to be abusive about having this mask ordinance. You know, I think maybe there's a lot of folks out there that just need to get off the Facebook once in a while and go outside and breathe the fresh air and get into towns where we're so fortunate to be in this community that it is easy for us to socially distance and to be able to get outside and be healthy. And we got to look at all the things that we have and be thankful for those and try to come together to get through this challenging time. And so I'm ready to move ahead with this. That's all I got.
Thank you, Colby. I don't have any further comments. I think council laid it out pretty well, and I agree with the comments about credible information and using the best information that we have available to us. So I'm going to call for a motion to, Bessie Joe, if you're on the line hearing me, we're going to work on resolution number 20-16. Do I need to call for a motion to read by title only, or how do we proceed?
No, for the resolution, I did send it out to everybody in email. And so it is moved to adopt resolution 20-16.
Thank you.
Everybody should have that in their email.
Thank you for your help on that. Would someone make a motion to adopt resolution number 20-16?
Mike, I'll make a motion to adopt resolution number 20-16.
Thank you, Mike. Is there a second?
I'll second, Bob. Thank you.
Thank you, Melanie. A motion has been made and seconded to adopt resolution number 20-16, a resolution of the City of Mccall extending the public health emergency order imposed by resolution number 20-12. Public health emergency order mandating requirement to wear face coverings in public places for an additional 30 days until September 1st, 2020. May I have a roll call vote, please?
Councilmember Machete,
Yes.
Councilmember Holmes,
Yes.
Mayor Giles,
Yes.
Councilmember Nielsen.
Yes.
Councilmember Sowers.
No.
So the motion passes. Resolution 20-16 passes. And we will now move on to talk about the penalties. As Justin laid out, we have two options. So I'm going to ask you to go back to, there are 2 pages. They're labeled, both of them are ordinance. And one is called, on the top right, it says version 1, civil penalty. That's the one that doesn't go to court, that's streamlined. We've talked about that quite a bit. Version 2 is the infraction version. Before we start down the path of making motions, I'm going to poll very quickly the council to see which version, whether it's civil penalty 1 or version 2 infraction you would like to take action on tonight. I will start with Melanie.
Thanks, Bob. I am currently in favor of version number 1, a civil penalty. I feel that our police force and all of the other departments involved in going with infraction would be pushed to the limit of what we could possibly, want from them. And this, could excel later, but right now I feel like a civil penalty is the right way to go.
Thank you, Melanie. Mike, what's your opinion on this?
I agree. I'm in favor of version 1, civil penalty.
Thank you, Mike. Tom, which version do you favor?
I'm going to say neither, but is that a choice?
You do get to vote once a motion has been made on one of these, so.
Okay.
You could,
Well, whatever the motion is, I'll vote on it.
okay,
Thank you,
thanks.
Mr. Mayor.
Thanks, Tom. Colby, what's your preference?
Yeah, I think the civil route would be the way to go. I guess we have further discussions on that.
This is Mayor Bob. I feel very comfortable with version 1, the civil penalty, for the reasons that Justin outlined to us tonight. Chief Williams did a good job of summarizing the advantages of that. It didn't seem like there's any downside from Bill Nichols' opinion on that. So I would favor version 1. Would a council member please make a motion to enact? Let's see, what's the wording we need tonight, and do we have an ordinance number for version 1?
Yes, the ordinance number is 991. So we need to suspend the rules and read by title only, one time only, ordinance number 991, version 1.
Thank you. Would someone make that motion on council, and then I need a second?
I have a question. So everyone is comfortable with the penalties on version 1. And so honestly, I'm a little bit leaning in
Colby, I couldn't hear you. Could you speak up on your concern?
Yeah, on I guess I had a question about the version of the penalty sizes for what we have in here, because I'm kind of on Tom's side with, not having a big penalty. But I guess my question, I guess, to the chief would be why these numbers?
What's your question, Colby?
We can't, you're having trouble, you're breaking up a lot, so speak up.
Oh, it must be my internet or something. Can you hear me okay?
Yeah, there's some feedback from someone somewhere, so, but go ahead. I'll do my best.
Yeah, I think that was Bessie Joe. She seems to.
There you go. Now we're good. Yeah, okay.
Yeah, so I was curious about the size, the dollar amount on the fines. What's the reasoning behind these dollar amounts versus something nominal?
So the dollar amounts are the ones from the previous, the council had passed previously. It was a $100 infraction previously. The fines for violations are established by resolution of the council, obviously. And so the dollar amount was one that the council came up with previously. There was no recommendation from my standpoint as what the fine would be. It makes no difference to me as to what the fine is or isn't. As far as the infraction section of it, the $100, that was from the previous mask ordinance that was there of what the penalty would be. And then the infraction portion, the $56 was state mandated court costs and such. So the civil fine of $100 is merely language coming from the previous ordinance. If you wanted to change that, if council was so apt to change that, you can change it to whatever it is that you choose to do by resolution. Absolutely, you set the fine amounts.
Sure, yeah, and that's kind of the question I had for everyone is what, how do we feel about these amounts, given we are changing this ordinance on how it's enforced?
There's one of the things that I would recommend if you're deliberating what a fine should be. You're looking to gain compliance, and fines serve as a deterrent. One of the things that amazed me when I came to the state of Idaho was how insignificant a seatbelt citation is. I think it's $15, $25, something like that. When I left Texas, it was $185. People wore their seatbelts. And so it depends on what it is that the council chooses to accomplish. There is a balance in fines, not being punitive, but being a deterrent and trying to gain compliance. If you make them the change in your pocket, as Tom suggested, people are just not going to wear the mask. There are other ways that you can get around not wearing the mask. If it's so insignificant, compliance will not be there. If it's too high, people will scream. So it's your responsibility as council to decide where you believe that should fall. Previously, you chose $100. Thus, the reason it was there for this particular violation as well. But it's entirely up to your purview.
Okay, so Colby, you've gone on record as not feeling comfortable with 100, and you asked the question, how do other people feel? My opinion on that is the $100 is a good figure. We have history in July, and seems to be working. Mike, what's your thoughts? And Melanie, what's your thoughts?
Thanks, Bob. I do not think that we should change from what we already have established. So I would suggest that we keep it as is and consistent with what we've already passed and extend it the same thing.
Okay, Melanie, your opinion?
Thanks, Bob. I feel like $100 is enough of a deterrent at this point, but not overwhelmingly punitive. I feel like people will look at it, and if it feels punitive to them, then they will comply. But $100 seems fair to me.
Okay, I think we've heard from all council members. I lost track. Bessie Jo, have we made a motion to adopt this ordinance?
No.
So I look for a motion to adopt, I believe it's ordinance number 991 with a $100 fine.
Sure, Bob, it's Mike. I would make a motion to adopt ordinance 991 and suspend the rules and read by title only.
Thank you.
Which
Is there a
version?
Version 1.
Thank you.
version
Second.
1.7 penalty? And Melanie seconded it. May I have a roll call vote, please?
Councilmember Machesik,
Yes.
Councilmember Holmes,
Yes.
Mayor Giles,
Yes?
Councilmember Nielsen,
Yes.
Councilmember Sowers,
No.
The
Okay.
motion passes. So we are going to ask you, Bessie Jo, to read by title only. Ordinance number 991.
Okay. Ordinance 991, an ordinance of the City of Mccall, Valley County, Idaho, amending Section 11 of Ordinance 986 to change the penalty section to reduce violations of the ordinance from a misdemeanor to a civil penalty and providing an effective date. And we do need to state what that effective date is. I just remembered that it is empty. So it would either be take effective upon posting in 5 locations or upon publication, which would be next Thursday.
I thought we said it would be effective August 2nd. Is there a
Okay, so
way, is there a way to, if we vote on it tonight, is there a way to do that legally on, have it effective on August 2nd?
It takes posting in 5 public places in town for it to become effective, and if it doesn't get published in the paper. So if you wanted it published in the paper, it would be on Thursday, which is the 4th, I think.
So we have a gap of 2 days with no penalty then.
I think that it's very similar to what we did last time, Mr. Mayor, and I think that it can be done. I would ask that if Bill Nichols could chime in, that would be great. If it needs to be posted in particular places, we could definitely take the lead on that. If that's what it needs, Bessie Jo, I can have our staff take care of that. And I know that Aaron is currently working on this as I speak as well, on getting it done. Similar to what we did the last time, we did not have to wait. It was in effect for the weekend, and it was on a Thursday when we did it. So I do believe it's possible.
Correct. Yes, I did speak with Bill, and that is correct. So I was just wanting clarification of what you wanted. If we post it in 5 locations, that's what I did previously. We just take a photo of each of those 5 locations, and it gets.
The press release is ready as well to give to the press to have that put out, so that notification will be made as well.
So that's what we'd like. We don't want to have a gap in.
Yes, sir.
Okay, Bessie Jo, help us with all of that nuance. We've read by title only, ordinance number 991. So we need someone to make a motion to adopt ordinance number 991. Is there any other language we need to add to that motion?
Mr. Mayor?
Yes, Bill, go ahead.
Yeah, Mr. Mayor, the motion should include that it would be effective upon public and posting in 5 public places in the city of Mccall.
Okay, I believe then the motion would read something like this. Make a motion to adopt ordinance number 991, version 1, civil penalty, and direct city staff to post the ordinance in 5 public locations within the city of Mccall.
Bob, this is Melanie. So moved.
Is there a second? Thank you, Melanie.
Mike, second.
Thank you, Mike. A motion has been made and seconded to approve ordinance number 991, version 1, civil penalty, and direct city staff to post immediately or as soon as possible in 5 public locations within the city of Mccall. May I have a roll call vote, please?
Councilmember Holmes,
Yes.
Councilmember Machezek,
Yes.
Mayor Giles,
Yes.
Councilmember Nielsen,
Yes.
Councilmember Sowers,
No.
Thank you, council. The motion to approve resolution 991 passes. I don't believe there's any further business posted on our agenda. So I will adjourn the meeting. Thank you, council.
Thank you.
Thanks.
Yeah.
Good night, everybody.
Good night.
Thanks, everyone.
Mm.